Hi, my name is Dr. Virginia von Schaefer, and I wanted to talk to you about some aspects of Lyme disease and the treatment of it that seem to me quite mysterious in the literature. We're told by the CDC that the primary treatment for Lyme disease is antibiotics. However, many patients take antibiotics and they have no relief from their symptoms. We're also told that Lyme can only be transmitted by a single tick bite. However, many patients have been bitten by other insects and seem mysteriously to have contracted Lyme disease. What's up with this? It's interesting because there is some new research that points to the fact that there are alterations in your immune system response to foreign entities such as unwanted bacteria or viruses because of the presence of Borrelia burgdorferi, and one of the many forms of infectious agents that are associated with the syndrome Lyme disease. Well, it's interesting because they say that somehow the dendritic cell function, these are the watchman cells in your immune system, is altered. And somehow that affects the way the dendritic cells educate the T cells about what to attack and what not to attack. And mysteriously, you end up with a kind of quote unquote autoimmune disorder, which is postulated as the possible way for Lyme to cause such severe joint problems. Well, I'm going to beg to differ with that. I think it has to do with other underlying infectious agents that are present, but not detected and certainly not studied in any of these research endeavors. Epstein-Barr virus, when you check somebody for Lyme disease, almost above 90% of the time is present in a chronic infection. And Epstein-Barr virus in a chronic infection will negatively affect the function of your macrophages. Macrophages are the only cell in your immune system that can identify unwanted entities and treat them, engulf them, and eliminate them immediately. They don't have to recruit T cells or B cells or anybody else to do it. If these primary cells, macrophages, are negatively affected by Epstein-Barr virus living inside them chronically, they will basically be altered. Their function will be altered because of the change in the epigenetics, because of the virus presence. I believe that this is a very key factor as to why patients who have chronic problems with Lyme disease, no matter what they do for treatment, whether it's antibiotics or diet or ozone or any of these other treatment modalities that are offered, if we don't identify and treat the Epstein-Barr, it becomes nearly impossible to eradicate. I have made several videos, and I'll refer you to them, on the SOT treatment, or supportive oligonucleotide treatments, that are produced by a research lab in Greece that can be applied for treatment not only for Epstein-Barr virus, but any one of the myriad number of organisms that are involved with Lyme disease, that can be simultaneously treated along with other treatments to eradicate and eliminate these serious infections. Hope is on the horizon for people with Lyme disease, but it has to be systematically evaluated and then treated. Thank you.
Sound good?